A very good day again, my dear first year postgraduates. We are all in the nascent stage and we have gone to the third class today. I hope you people are able to recollect the previous classes. Even otherwise, don't worry. Now, this is again a recapitulation. I had shown you this in the previous class. So I am finding what is this epithelium? Good. It is a columnar epithelium. If you have got any doubt, see this. Go to the higher magnification and see. You are able to see a columnar epithelium. It is being replaced by stratified squamous epithelium. So it is a squamous metaplasia. If you have got any doubt, look at this again. So here again, I am finding a columnar epithelium. See, tall. And there are some cilia over here, ciliated epithelium. And that is getting replaced by the squamous epithelium over here. So it is a squamous metaplasia. When in doubt, compare. Compare this diagram with this. By that, we will be reinforcing. Now, I would like you people to look at both the pictures and tell me the differences. So, this is a trachealis muscle, so the clue should be there. Good. It is a trachea. And it is again having some kind of it. The alveolar spaces I can see over here. So it is from the lung. So after the trachea, I'll be having the bronchus. This bluish color is always there for the cartilage or calcification, etc. So in the trachea, I'm finding a large ring of cartilage which is incomplete. If it is totally complete, then you and I cannot breathe. On the contrary here, again I am finding that there are bands of cartilage which are broken or intermittent. And there are the other tissues, we will not go into it because the class for the day is cartilage. There are different types of cartilage. This is something called as fibrocartilage. A lot of these pinkish ones are all fibrous bands, within which or in between which I am finding cells called chondrocytes. Chondrocytes are cells of cartilage which are arranged in an orderly manner. Always in pathology, we must emphasize on the arrangement. So they are all in an orderly manner, just like ants, which are going one behind the other. So what is the structure? You people should be able to identify now. I'm having a rim of it and there is the cartilage which is incomplete. So it is a trachea. The components, you people go back to the previous picture. Now this is a classical diagrammatic picture of the cartilage. I am finding always the labels matter. This is the perichondrium which is rimming the cartilage. Then there are some fibers which are supporting it. These large cells are chondroblasts. Chondroblast means immature, chondrocyte means mature. They have got the nuclei and look at this carefully, they are placed within a space that is called the lacunae. Lacunae means empty space. Here there are two cells, chondroblasts, which are there within the lacunar space. And these are the capsules for it, or the membranes for it. If you have got some doubt, you compare this. As I told you, always compare. Perichondrium here we are seeing, here also I have seen. Chondroblasts are immature cells, and then chondrocytes are mature cells. Usually they will be seen in pairs. So look at this one, they are in pairs. They are in pairs over here. And the empty space is the lacuna. And this bluish color is the matrix. Matrix is any supporting substance or tissue, extracellular matrix. Good. Look at this. So this is a bone, fine. And what will you be having at the end of it? This is an epiphysis and there is a grayish color. This is the cartilage. And this is a bone proper. So it is an osteochondral junction. What are we seeing in the osteochondral junction? This is all the entire cartilage over here, the entire cartilage. And this is subchondral bone. Subchondral bone. This cartilage itself is divided into superficial, middle, and deep. Superficial means it is not so very mature, but later on you find it becomes perfectly mature. And they are also very orderly in arrangement. And there is a matrix that is separating it. And this is the costochondral junction, below which there is a subchondral bone. More than costochondral, I should have called it osteochondral junction. Are you able to identify many things that we had mentioned so far? What is the organ anyway? So I am finding the epithelium, that is C. And here I am finding what is this one? Lacunae. Cells are in pairs. And there is a supporting ground substance, matrix. So this is a cartilage. So this is the tissue from the respiratory tract, maybe trachea or maybe part of the major bronchus. And this is the smooth muscle over here. This empty space we shall come to, it is fat. We shall see it at a later date. There are different types of these cartilages. All said and done, you will be having this kind of a configuration. Cells in pairs or in even numbers, usually. Again in pairs. So this is called, again, a hyaline cartilage. Whereas here it is more of a fibrous cartilage. That is over here. Look at this blue color. It is a hyaline cartilage, lacunae, and within which you are finding the cells. So match fixing. So they are in pairs. Okay. These are all the chondrocytes. And there is a surrounding lacunae, around which there will be the cell membrane. And these are all the chondrocytes. The bluish color is the matrix. External is the connective tissue. To study the abnormal is the best way of understanding the normal. William James. I would like you people to identify this. What is this particular one? What are all the structures you are identifying? Explain it to me in the next class. But this is mainly for comparison of this particular zone with this. Try to identify. We shall see you in the next class. And also number the components of this. Thank you.